Literally millions of people in the US are suffering from type 2 diabetes. There may be help locally with a natural approach that can help lower and stabilize blood sugar levels, help a person lose weight, and in some cases, even get them off their medications. Dr. Shani is here to talk to us about how he completely transforms the lives of type 2 diabetics in his clinic right here in Los Angeles. Dr. Shani, why is type 2 diabetes increasing to epidemic proportions? With all the diabetic drugs available, why isn't this disease cured by now?
Well, I believe that the reason is that the approach that most doctors take is to simply prescribe medications to artificially bring the blood sugar down. They also tell the patients to lose weight and exercise, but they're not looking for the underlying imbalances in the body that are causing the blood sugar to come up to begin with. For example, one of my patients came to see me on 3 different diabetic medications. His blood sugar was over 300 and he could not lose weight. Once we completed all the necessary testing, I was able to customize a treatment plan for him, and in less than 60 days, his blood sugars went down to normal levels. His doctor was able to get him off of most of his medications, and by the end of the program, he ultimately lost about 45 pounds of weight. His blood sugar levels, his cholesterol, and his blood pressure levels were all back to normal.
Why do you find that diabetics ultimately come see you for help?
Well, mostly out of frustration. They have been told by their medical doctors to take their medications, and they should certainly do so. They've been also told to lose weight and exercise and watch their diet, and even though they follow all these recommendations, there's basically no results. And the reason they don't see any results is because, in my opinion, there's not a definitive guide on diet, weight loss, and exercise for every diabetic patient. Every diabetic patient is different, and the treatment plan must be customized for their specific health issues. And that's what I do. We take a diabetic patient, we run very comprehensive tests, and then customize a diet and nutritional program for their specific needs. In addition, what is really interesting is that in the beginning of the program, we take a lot of our patients off their exercise routine, and still the results are astounding. Ultimately, patients who have diabetes can see the writing on the wall. In many, if not most cases, diabetes gets worse with age, not better. Diabetics are required to take more and more oral medications. They continue to put on weight. They have less energy and less stamina, and they really begin to run all the risks of the devastating effects of diabetes, like heart disease and kidney failure, blindness, loss of limbs. And ultimately, their doctors are required to recommend insulin injections simply because their blood sugars are not being kept at a safe range. With our approach of customizing a treatment plan for each diabetic, we typically see the opposite happen. In our office, we routinely see our patients stabilize and lower their blood sugars. They lose significant amount of weight, often without exercise. They have more energy and more stamina. They have better sleep cycles. Many of our diabetic patients are able to reduce or eliminate their medications with the supervision of their primary doctor. We have also seen many patients keep their blood sugars in a non-diabetic state with no medications at all.
I know you have very strict standards in who you accept into your practice. What do you look for in a diabetic patient?
Well, first I want to make clear that this is not a standalone treatment. If you are going against your doctor's recommendations and you're not taking prescription medication, or if you do not have a primary doctor overseeing the disease, then you're simply not going to be considered for the program. In addition, what we're looking for is someone who takes their health very seriously. This is not a program where you can suddenly stop taking your medications. This is not a quick fix. We work directly with the primary doctor to make any medication adjustments. My program is only for diabetics who are on medications and are looking to take active role in their health.
This is really fascinating because most diabetics have lost hope, and what you're telling us is that you offer something different than a drug-based approach. If you don't mind, could you share another success story with us?
Sure. I have a patient that is currently under my care. When he came to see me, his blood sugar was at 364. His cholesterol was in the high 300s. His triglycerides were at 611. After 45 days of following my program, his blood sugar went down from 364 to 160. His cholesterol, total cholesterol, normalized. and his triglycerides went from 611 to 198. He lost 25 pounds of weight in 45 days, and he still continues to progress.
What would you suggest to a person who has type 2 diabetes and is watching the show right now?
If you're a type 2 diabetic and you're really motivated, you should contact our office. This is for type 2 diabetics who are ready to take an active role in their health. If you simply want more information, you can go on our website at drshani.com.
If you would like to see if you qualify for a type 2 diabetic evaluation with Dr. Shani, please call 805-494-9977. For the first 20 viewers who call, you'll receive a complimentary consultation with Dr. Shani. That's a $245 value. Once again, the number is 805-494-9977.